Hey guys, I was just reading one of my favorite research studies, and I like it not necessarily because it's a study; it's actually a commentary. But it's this one here. The spinal cord is the organizer of disease processes, and it's by Irvin Core. Many of you have read this before, or many of you have seen people quote this before. I think it's worthwhile for you to go through and read these research studies and make your notes on them. It elevates your game. That's what it does. So I thought it was worth a quick review. There are certain things on here. I love the way that Irvin Core talks about the nervous system. He talks about it he's almost like an incredible storyteller, talking about how the nervous system is designed, what happens when there's the afferent input back into the system, what happens to the efferent input, and how those are interrelated based on the different segments of the spinal cord. He talks about how a subluxation at a particular level can affect a little bit above it and a little bit below it on the cord. So it's not always specific to an exact level, but a generalized area that's involved with the symptoms that show up. Let's say as an example, if you said T9, T9 could have an effect on the duodenum, could have an effect on the adrenals, could have an effect but so could T8 and T7, depending on the person. So what he was talking about was it's not exactly at a specific segment from which the nerve root leaves the spinal cord, but it's specific to a certain region of the spine, which I think most of us have known, but I thought it was pretty cool. And he talks about the main functions of the sympathetic nervous system and whatnot, and I thought it was pretty neat. He started to talk about the segmental facilitation. So many of you have heard of segmental facilitation. So what that is there's an aberrant amount of input coming into the dorsal root, going into the spinal cord. So the dorsal root of that spinal nerve brings all of the feedback from all the different parts of the body, right? So you have at all times information coming from sensors in different body parts. So you have the Ruffini endings in your in the joint capsules, right? So when there's a joint capsule, let's talk about the spinal runs around the zygapophyseal joints. You have this joint capsule, and there's Ruffini endings in there that tell your brain feedback about whether or not those are being stretched, or there's some type of abnormal force going through them. There's the Golgi tendon endings, which are in the in the muscle tendons, mostly responding to stretch. And then you have the spindles and the muscle fibers responding to stretch. So those three things, they respond to changes in force or tension, and changes in stretch, or changes in length, which is usually stretched. So if you have a muscle, muscle that's been stretched on one side and in spasm on the other, there's going to be an abnormal amount of afferent input coming in. But what he draws to is that because you have, let's say, damage or subluxation at one area, because there's chronic afferent input, it affects everything that's in that spinal nerve area, including then what happens from an efferent standpoint. So he uses an example of how a mid-thoracic problem can cause a problem with the duodenum. And we've seen this every day in practice, but it's sometimes just helpful to relook at some of the anatomy of it, refocus on your ability to explain it, your ability to write it, your ability to understand it. So I thought this was pretty good. He says, whatever the cause, there's a disturbance in the movement of a particular intervertebral joint. It involves these functional disturbances. There's muscle spasm and hence persistent changes in length and tension, which those receptors respond to. There's torsion or other deformation of the joint capsule, right? So that when the joint moves, there's deformation of the joint capsule. And then there's asymmetric ligamentous tension, right? In those three things, if those three things are there, then the affected proprioceptors will fire equally persistent and discordant barrages of impulses. These enter the cord via the one or two dorsal roots in which the corresponding sensory fibers lie. So what does that mean? So that means that the nerves are being interfered with. And then he goes on to describe, well, here's all the ways that they knew, and this is in 1976, that the nerves could get interfered with around the level of the spinal canal. So you can have compression of the nerve by narrowing of the foramen. Well, we all know that one. Adhesions between the roots and the sleeves, causing angulation, shearing, and constriction of the nerve. Shearing forces acting upon nerves passing through the fascia, right? So you have the fascial tissue there. Compression by sustained contraction of the paravertebral muscles through which the nerves pass. So what he's talking about is that even if you have that muscle spasm off to the side of the spinal canal, that abnormal muscle spasm over here will cause a facilitation of that nerve, which automatically creates a disafferentation challenge at that specific level. Constriction at the dura-arachnoid junctions of the root pouches, compression within the foramina secondary to venous congestion, hypoxia, pH shift, and other chemical changes that can cause. They're all important factors in the alteration of axonal excitation and conduction. This is nerd speak, but sometimes you got to do it. Basically, at the end of the day, the clinical impact is that syndromes may be produced given sufficient time, and these depend, therefore, on the segmental level, since that determines which organs and tissues may be in the line of fire. So I think that there's a lot. I try to summarize a long article all in a few minutes here. I think I even went longer than normal, but these are things that you should do. Pick up these sheets. The spinal cord is an organizer of disease processes. It's a good one.